Hello, this is Ms. Roberts. We're going over Chapter 22 in Davis Advantage book, Caring for the Child with an Integumentary Condition. So talking about the skin. This starts on page 751 in your book. Of course, there's a picture of the skin in your book on page 752. Just another anatomy review. Make sure you understand how the skin is laid out. On 753, it starts showing you different skin lesions and conditions. I will give you a handout in class that has some really good pictures of the different types, the macules, papules, lentifications, all that stuff. But there's some good pictures in the book as well. Let's move to, there's another one here, just like the different pictures. There's some examples here. So a cafe latte, vitiligo, freckle, that's a macule, okay? Eczema, psoriasis, that's a plaque. Urticaria, that's a wheal. TB, melanoma, lipomas are tumors, herpes simplex are vesicles, okay? And this is the picture. I'll give you a copy of this. Really good demonstration of what those skin lesions are. Alright, so let's talk about skin infections. A huge one, and this is on page 759, the huge one in kids is impetigo. Okay, impetigo contagiosa. It's a bacterial staph. And the biggest thing, lots of winks and lollipops in this section, biggest thing is that it is the honey-crusted lesion. Okay, honey-crusted lesion. So, very sticky exudate, but it is that honey-crusted lesion. Okay. So if you see or have a question on NCLEX or an exam about a honey-crusted lesion, sticky exudate, that they're talking about impetigo, and you can see this is what it looks like later on. Okay, once they erupt, it starts out and they erupt and they have that honey-crusted lesion. Okay. How do we treat it? So Bactroban, okay, mupirocin, huge use of that with impetigo. Two of my kids got it at a summer camp that was going around, and so we lived with mupirocin for the summer. They can also receive Keflex. You know, that's our antibiotic of choice for any type of skin disorder, and even clindamycin. Okay, so it is staph, so that would and augmentin too, so that will cure that staph. Okay. MRSA, methicillin-resistant Staphylococcus aureus, is another one that they get. The most common symptoms with that are the vesicles and pustules. So make sure you understand that. This is the most common type of skin infection, okay? Some of the lesions would resemble a spider bite, warm to touch. When they rupture, that's like a pustular secretion, yellow and white. But make sure you know these winks and lollipops, okay? Honey-crusted lesion, we're using mupirocin, Bactroban for treatment. Then for MRSA, the treatment is on page 762. You have some different medications for acne listed here, but going on to 762, of course, the first line treatments are listed. If it is severe MRSA, then Vanc is our answer, okay? But if it's mild, then we can use that antibiotic cream, Bactroban, Bupiricin, okay? And the Cleocin too, all right? And doxycycline. Goes on to talk about on 762 the cellulitis. And this is a picture of the eczema. We'll get to in just a second. Okay, it kind of switched my pictures. So let's look at on page 763 molluscum contagiosum. Okay. Here. So this is caused by a pox virus. It's transmitted directly from infected skin, can be sexual, non-sexual, or auto-inoculation, but it's just little papules. This is actually a picture of my son, my youngest son's arm. He, same summer camp, the next summer he got molluscum going around. It's outdoors camp and everybody there has around molluscum. So, yep. But they scar. Okay, so really not a good treatment. Took him to the pediatrician, and she was like, I don't know the answer. I did some research online and found a cream that actually helped. Ordered it from Amazon. I don't remember the name of it, but it worked, and they went away. But they can last a while. Like his lasted about 6 or 7 months, but he's almost 16 years old now, and I took these pictures just a few months ago. So it scars for life, and it's just like little divots in the skin. But this is what they look like. If a child has molluscum, you know that you don't need to be sharing items. You don't need to be letting them bathe together. You know, if they're little, of course, you know, that's what parents do, but they shouldn't be sharing towels. They shouldn't be sharing anything because it is contagious, okay? If you see molluscum in the growing area, in the parts of the body, then this can be considered sexual abuse because it doesn't just happen in those areas. So just be aware of that when you're doing your assessments. If you see some molluscum there, it can reveal that the child's been sexually abused. HPV, this is human papillomavirus, warts among children, contact with hard surfaces, plantar warts, anything like that. They look like a cauliflower, they're raised, they're flesh colored. And then let's talk about the tinea capitis, corporus, curus. We talked about this, right, in the last module. So make sure you understand those, read through that. That's on page 764. And then we're going to talk about eczema. So let's go, and dermatitis. So let's go back and look at eczema. So this is eczema, okay? It's just that plaque. It's called the itch that scratches, okay? Make sure you read through that. You understand. If you see atopic dermatitis, same thing. That's eczema, okay? So just make sure you understand that. Blood tests reveal that IgG antibodies, okay? Again, atopic dermatitis. But very right there together, okay? And so you can see the definitions here. I do want to point out the nursing care tea is a Winkin' Lollipop. You need to make sure that they are moisturizing, especially right after baths. And apply some topical corticosteroids. That's written in my book. So along with moisturizing, they're applying some topical corticosteroids. You know, you shouldn't use corticosteroids on skin over a week because it can damage and thin out that skin. So they need to be educated on that as well. Alright, on page 767, we're talking about pediculosis capitis. This is a seborrheic cradle cap, okay? So this is seborrheic dermatitis, okay? So before we get to pediculosis capitis, let's talk about the seborrheic dermatitis. Cradle cap, okay, known as cradle cap. Men can have it in their beard, too. Just a dermatitis, you need to educate them, you know, to massage in the baby oil or even olive oil to remove those scaly pieces of skin to loosen that up. Alright, pediculosis capitis, this is lice, okay, head lice. Up to 12 million kids a year get this in school. The one on the head is capitis, the one on the body is corporus, like corpus, and then the pubic area is pediculosis cutis. You know, the street name for that is crabs because it looks like little tiny crabs, okay? But they are live lice. So on page 768 at the very top, it's describing some things that you need to know, and it's right here. So you have that pearlescent teardrop that's laid at the base of the hair shaft, and you can see those here, how they're like a little pearlescent shape there, little pearlescent teardrop shape there. The louse, which is the live big lice that's laying the eggs, you may see it crawling around in the head of the child. But they like warm, dark spots. So like behind the ears, the nape of the neck, you need to be checking. Lighter colored hair, oilier hair is where they like to be. So make sure you're checking that. Alright, scabies. This is on page 768 and 769. So it's a mite infestation, okay? More common in persons who live in crowded areas. So if you have someone that, you know, there's a lot of people that are living in the home, it may be more prominent in that home, okay? And this is where they like to be, in the warm, dark spots, okay? So this child is eating up with them. They like to be in that palm between the fingers, okay? Periumbilical skin, so around that, the axillary folds, genitalia areas too. So prevention, how do we prevent scabies? Okay, don't share beds, don't share clothing. Everything needs to be washed in heat and set outside for up to 10 days. You know, you wrap up mattresses, you wrap up clothes in trash bags to smother these mites, okay? Permethrin cream is used, and it is actually approved for infants over 2 months of age, okay? But we don't share, we teach them not to share anything. If one person has it in the house, the entire family is treated, okay? It's very important that they are treated, because if they're not, they're just going to keep passing it on to each other, okay? Everything is treated. Bed, clothing, towels, toys. You just you know, I advise them to throw out all the stuffed animals, throw out all the pillows, if they can afford to do that, because they just stay there. So, of course, Winks and Lollipops, you need to know the prevention and the nursing care, okay? That you're washing everything in the extremely hot water, as hot as their water will go. All right, Lyme disease. Lyme disease is caused by a tick. This is on page 770. It's a tick-borne infection, Borrelia burgdorferi, most common vector-borne in the United States, vector-borne disease, caused from a tick bite, okay? See a lot of it in kids ages 5 to 14 because they stay outside, right? Anybody that's been in the wood, but your telltale sign that it is Lyme disease is this bullseye rash, okay? Bullseye rash. If you say bullseye rash on anything, and I don't know that that's in your book, but I would write, well, it's right there. Bullseye rash, okay? Important for you to know. You see a question about a bullseye rash on your NCLEX, then it's going to be talking about Lyme disease, okay? Especially if it's like there's a kid that went on a camping trip, came back with a bullseye rash. They're talking about Lyme disease, okay? Another one is Rocky Mountain spotted fever. So they went on a vacation, and they came back with this rash. This is also talking about, and it's tick-borne as well. So Rocky Mountain spotted fever, page 771. It's talking about Rocky Mountain spotted fever. Tick bite that happened in the wood, it causes this rash. This is Rocky Mountain spotted fever. Okay, dog tick, a wood tick from the Rocky Mountain area. So highest incidences is around where we live, okay, the southeastern United States. So there's the states here. Starts with a headache, a fever for a few days, and then later on you get this rash, okay? And it is, like I said, caused from that tick, okay? And we all went through BLS and first aid, so we know not to just jerk a tick off, right? You need to squeeze it, let the tick let go, and then pull it off. So you don't just snatch a tick off, because you can get Lyme disease by leaving a piece of that tick in the skin. We talked about cat scratch disease already, but it's mentioned there again, the lymphadenopathy. Alright, let's talk about burns. This starts on page 772. Of course, you know the skin is the largest organ on the body, right? It regulates temperature, prevents fluid loss, helps us with sensory function, vitamin D. But if the skin is damaged from a burn, there's a lot of things that can go wrong. There's different severities. There's different reasons for the burn: electrical burn, radiation burn, fire burn, flame burn, all the things. So I want you to look on page 774. And we're going to talk about the size and extent of the burn, okay? This is the rules of 9. Wink and Lollipop, you need to know what the rules of 9s are. And I'm just going to tell you, you need to memorize this chart. I'm going to give you a copy of this chart. You need to know how to figure, and there's one in your book too, here. So it just kind of breaks up the front and back. So in a child. And this is just anterior pictures, but this one is broken to anterior and posterior, okay? So if it says the back of the leg, So you would do back of the right leg, you would do 9%, right? Or the entire right leg, you would do 18%. But we'll practice this in class. But just make sure you understand that rules of 9, okay? That you know that. And we'll practice this. There's just an example over here, and we'll do some practices of those. Look at box 22.1. This is an algorithm for the burn injury. You need to know what to do. So we know, first and foremost, we worry about our ABCs, right? You inhale and smoke, you're burning that lung tissue. So what happens to damaged tissue, burn, it starts with inflammation, edema in there, and can cut off the airway. So that's how people die from inhaling smoke. Okay, so ABCs, make sure. Intubating, first things first. They may be still breathing when they come in the ER, but they inhaling smoke, you need to get them intubated because that tissue is going to start swelling. Okay. Hypothermia on page 778. So let's talk about that. Secondary to cold air, water, wet clothes, immersion, like in frost, falling in a frozen pond or something. But signs and symptoms of this is where the temperature is between 93.2 and 96.8, okay, which is 34 to 36 degrees Celsius. Shallow breathing, increased metabolism, vasoconstriction. So just make sure to read through those. And then there's some pictures over here of frostbite, okay, damage to the skin. And I'm going to give you a picture of this as well. But you have the normal skin, the frost nip, which is on her face here. Superficial frostbite, you see this swollen tissue, and then deep frostbite is here, losing those fingers. And that is it for chapter 22.